Then there's California. That's the name of this podcast featuring members of the California State Senate Democratic Caucus in conversation about their legislative priorities, policies, and other related issues that make California exceptional. From the state capitol in Sacramento, I'm Brian Green. I saw recently a little metaphor that applies perfectly to the topic of this podcast episode. Pop singer Britney Spears has a song called Toxic, and in the song there's a lyric that says, "A guy like you should wear a warning." Okay, most guys don't have warning labels, although maybe in California they should, but other potentially toxic influences in our lives do have warning labels, like cigarettes. And there's been a growing passion across the country and in California for slapping a warning label on sugary drinks, just like we do with cigarettes and tobacco, because of the reported direct health risk link between soft drinks and such pernicious health hazards as diabetes and obesity. The whole debate over warning labels on sugary drinks, and even a soda tax, has been a source of controversy at the state capitol in one form or another for at least a decade now. The soda industry has pushed back vehemently against any sort of warning or tax, and in fact, earlier this year, the U.S. Court of Appeals blocked a local city ordinance in San Francisco requiring health warnings on soda ads, saying it violates constitutionally protected free speech. But at the state capitol in 2019, the evangelical advocacy for health and against this liquid sugar continues, as more and more studies in the 1980s and 90s revealed evidence of smoking's disastrous and deadly effect on health. The tobacco industry was fined and restricted in its influence over Californians, particularly young Californians. In 2019, the soda industry is considered the new tobacco industry, and legislation has once again been proposed at the Capitol this spring that, it is hoped, will ultimately discourage the consumption of sugary beverages, with the intended effect of making California more healthy and saving more California lives. On this edition of Then There's California, we're going to discuss the latest incarnation of pushback against the unhealthy consumption of sugary sodas and other drinks, the details and stats behind the beliefs and the passion, and whether the influence and impact that the soda industry has on the diets of millions of Californians will, like that soda that's been sitting on your kitchen counter for the last 2 days, ultimately go flat. Joining me this time on Then There's California is a state lawmaker who's been a leading advocate of reducing childhood obesity and other preventable chronic illnesses through the reduction of the consumption of sugar-sweetened beverages. State Senator Bill Monning represents the coastal and inland regions of California's 17th Senate District. A former assemblyman as well, Senator Monning has focused much of his legislative priorities on the health and holistic existence of Californians, whether it's promoting health care reform, providing Californians access to clean drinking water, or even giving Californians the option of dying with dignity. With Senator Monning is a guest who brings facts and science to this issue. Dr. Flojan Kofer is an epidemiologist and a researcher and state policy manager with Public Health Advocates, a California independent, nonpartisan, nonprofit organization at the forefront of solving the obesity and diabetes epidemics by advocating for groundbreaking policies that build a healthier California. Senator Monning, Dr. Kofer, welcome to Then There's California.
Thank you for having us.
Like with smoking back in the day, I assume you concur that we are at a public health crisis right now with the soft drinks and the other sugary drinks that are pretty much ubiquitous in our lives.
Absolutely. We are at a place now where we have an obesity epidemic, and we have data to show what the contributors to that are. And certainly it's multifactorial, and that means that there are many causes that contribute to us experiencing this epidemic. But certainly what we eat is part of those lifestyle factors. And then there's also the other things that come along, including traumas that we experience and the mental health impact of that, as well as the physical health impact of that, as well as the way that we structure our day and the amount of movement that we get. And so all of those things come together to shape how heavy we are and the health impact that has.
And they are everywhere. They are ubiquitous, right? I mean, they are in vending machines. There's the big gulps in the restaurants. There's the hardware stores. You can get them at drugstores, hospitals. If you go into the cafeteria at the hospital, there's the soft drinks and the sweet drinks, the schools, even on the kids' menus at the restaurants.
Yeah, well, that's right, Brian. And I want to thank you. And then there's California and Dr. Kofer for giving us this opportunity today. And I think, as you mentioned in the introduction, the real focus here is children's health, adult health, and medical data, medical science showing the adverse impacts of sugar-sweetened beverages. What we do know is that there are increasing trends of preventable type 2 diabetes. And we always make a distinction because some children are born or acquire from an autoimmune deficiency type 1 diabetes. That's not what we're talking about. We don't want to stigmatize those children. The issue, the challenge, the health challenges are multifactorial. As the doctor mentioned, nutrition, exercise, living environments, etc. But what we do know is that the sugar-sweetened beverages are the single leading contributor of not just caloric intake in children, but bad calories. What used to be called adult onset diabetes, type 2 diabetes, it's no longer called adult onset because we're seeing it in teenagers, we're seeing it in preteens. You alluded to the lawsuit that focused on advertising really of another type in San Francisco. Those ads were to be placed on buses, billboards, etc. They were public advertising of a product. This is a product warning label. We're confident that by giving consumers the right to know, just as we've done with tobacco, science knows this, doctors know this. What we're saying is parents making a choice for their children should also have an informed choice. And I would like to maybe turn back to Dr. Kofer and ask her, we get the critique, why are you picking on soda and sugar-sweetened beverages? There's sugar in other foods. There's sugar in Twinkies. Kids aren't exercising as much. Why are you picking on sugar-sweetened beverages? But maybe you could provide a little more of the reason why this is such a culprit in our public health.
Absolutely. And you mentioned it. The sugar that we get from drinks is the number one contributor to the sugar that we consume in our diets. But more than that, we think this particular policy strategy is incredibly important because so many people are not aware of the impact that it has to drink your sugar. So what we know is that if you consume just one sugary drink a day, these are drinks with added sugar, you increase your likelihood of having diabetes by 26%. If you consume just one sugary drink a day, as a child, you increase your likelihood of being overweight or obese by 55%. When people are consuming these beverages, that's not what they're aware of. They think that all of these beverages are just part of your diet, and if we don't have them too often, that's fine, and what is too often and what is too much. And they're not recognizing that just one a day can have a really significant impact on our health. And that's part of what this warning label is about. It's being able to provide people with information so that they can actually make the informed choices that we hope consumers are making. And what we know is that if you don't have the information, you're not making an informed choice. You're making a choice, but it's not one that has all of the information where you can decide. We have warning labels on alcohol, and it does not stop people from going to happy hour and enjoying a drink, but it may make a woman who is pregnant reconsider her drinks because the warning label says this is something that could be particularly dangerous during this time in your life, and so you should operate accordingly. And that's really what we're trying to do here, is make it so that people have that information so they can actually make a choice, and that the choice isn't made for them because they just don't have the information.
And just to pick up on that, what Dr. Kofer is saying, we have opponents who say, well, this is nanny government. Don't tell us what we can or can't eat. The warning label legislation does not suggest that these products should be taken off the shelf. It simply suggests, as Dr. Kofer mentioned, that the consumer should have the right to know. And then opponents say, well, everyone knows that sodas have sugar in them. Where have they been? They don't need government telling them this. Well, then let's take another step forward. The industry has reacted to the focus on sugar-sweetened beverages, and they're actually camouflaging some of their products now by marketing them to children as sport teas, energy drinks. The advertising, millions and millions are being spent, and they're targeting marginalized communities, low-income communities. They're specifically targeting them with images of greatness in sports, greatness in entertainment, greatness at whatever level of participation, somehow linked to the consumption of these products. And when we add to this equation that in some of the marginalized communities, low-income communities, what might have been a treat for those in yesteryear of an 8-ounce bottle, I show my age, a 12-ounce bottle, the current bottle sold in vending machines is 20 fluid ounces. And in supermarkets, it's 2-liter bottles that are being marketed, advertised, and sold for less than an equivalent amount of milk or water. So we're up against hundreds of millions of dollars, just like the tobacco industry did, trying to influence the choice of families. So when a family on a limited income, a fixed budget, maybe sporadic employment, goes into a supermarket and they're making choices of what they can take home in their shopping cart, and they see a 2-liter bottle of one of these sugar-sweetened beverages, it's less expensive for that family budget than water or milk. What used to be a treat is now a staple in a family diet, breakfast, lunch, and dinner. It's just sitting there in the refrigerator. So this is what's added to what has been recognized by doctors, not politicians, as a public health epidemic.
And in a lot of these communities, it's considered something that's needed.
And that's probably the thing that makes me the saddest, is that when I think, the senator is right that many people are aware that sodas are this class of products that don't really have nutritional value. But when we start to talk about the energy drinks and the sports drinks, we're seeing that people are saying, well, I need electrolytes and these are important for me. This is a part of my diet, and not recognizing that sometimes those products have as much, if not more, sugar than the soda products that you are choosing. You're choosing these products instead of them. And so that's a really important thing for people to understand. And some data with UCLA that we partnered with them to help to promote showed that in children 2 to 5, there was a big increase. Even when we saw a decline in overall sugary drink consumption, we saw a big increase in those children who were consuming electrolyte replacement drinks that had added sugar. And so those are the kinds of shifts that we don't think parents are saying, I want to find my sugar in other places. We think parents are saying, this is a healthy product, and we want to make sure that we give our children healthy products because they're playing sports or because they're doing other things, and not recognizing just how much sugar is in those products.
And just to add on to that, when Governor Schwarzenegger was governor, he led a campaign to get sodas out of schools and vending machines and at school events. But included in that legislation, or not included, were some of these what I call camouflage sugar-sweetened beverages, the sport drinks, the sport teas, etc. So they've simply replaced the Coke and the Pepsi in the vending machines, and that's the go-to drink for kids. And you combine that, some of our school sites don't have clean, safe drinking water coming out of the fountains, and kids are relying on sugar-sweetened beverages. And again, back to some of the opponents' arguments, I have carried in the past, others have carried the suggestion that we should tax these products. And people again say, nanny government, why raise taxes? Well, whether you consume these beverages or not, society is going to pay the cost, is paying the cost for these increased trends in preventable chronic disease, in preventable diabetes type 2. And to do the work I do, you have to be an optimist. I think it's the same for Dr. Kofer. So when I hear the term preventable diabetes type 2, I focus on the word preventable. So it's preventable. What do we need to do to prevent it? The warning label is not the solution, but it's part of a public health strategy to raise awareness, to raise public education. And it's interesting, it's Big Soda who's told us in their opposition to raising taxes, it's really not a question of raising taxes, it's a question of education. So we're taking them up on their advice. They say it's a matter of education. This label warning fits right into that category of public education.
Well, you mentioned the opposition, the industry, Pepsi, Cola, Coca-Cola, the American Beverage Association. They have spent millions of dollars lobbying this, not just here in California, but in other states. There's celebrity endorsements for these soft drinks, for the sugary drinks. Is there a fear that maybe they're scared that the labels will actually change behavior?
Absolutely. I mean, we know from the study that was published in Pediatrics in 2016 that when you compare different types of labels, they do change parents' decisions in what to purchase for their children. Similar data would be necessary to look at what overall adult purchasing would be for themselves. But what we see is that when you compare the clear on calorie labels, which is when they put the calorie right on the front, to actually having a warning label, the warning label does come along with the greatest decline in parents who are choosing those beverages. diabetes, and also parents who are the greatest increase in parents who are aware that these beverages may be less healthy for my children. So that's a big change, but it does not mean, and I think this is the important part to identify, it doesn't mean that nobody is going to purchase these beverages. As Senator Monning said before, this is not a bill to be able to put anyone out of business. This is a bill to be able to make sure people have the right information so they can make decisions. And so when people are trying to reduce sugar, whether it's for health reasons, we have in California 46% of our population has pre-diabetes. That means they are already at increased risk for developing diabetes. Combined with the almost 10% that have diabetes, that's over half of our state's population that is either in the pipeline for diabetes or already has it. So if we're talking about half of our population going out and trying to navigate ways to prevent developing diabetes or to prevent the diabetes being out of control and resulting in the loss of limb and the loss of eyesight and all of the consequences that come along with uncontrolled diabetes, this is incredibly important for people to be able to immediately look at a product and say, this is one of the ones that I at least need to be careful about. Even if I'm not making the decision to never drink it again, this is one of the ones that I should not have copious amounts, as part of my diet. That's important. And we think that messaging is important for all Californians, but especially for the over half of our population that is already at risk.
And when you combine the hundreds of millions of dollars of targeted advertising in families, low-income families living on fixed budgets, paychecks that don't necessarily stretch the whole month for basic necessities, including food, that all combines to put these front and center, these products, these drinks, as a choice that's kind of a forced or an influenced choice. As Dr. Kofer mentioned, many children and many parents, they hear the word diabetes, they don't necessarily know what that means. They don't know that it means reduced lifespan. They don't know that it means potential amputation of limbs. It means a poor quality of life. That most parents, when given the choice, they want what's best for their children. We were successful last year, the first legislation in the country, statewide legislation, to try to influence buying habits of sugar-sweetened beverages for children. We carried, and the governor signed into law, a bill now on children's menus in the state of California that the vendor, whether it's a fast food restaurant or a sit-down restaurant, the key is if they have a children's menu, the default drinks offered will be water or milk. Now, a parent can still override that if they want to make the choice, again, for the treat of a sugar-sweetened beverage. Doesn't prohibit it, but we're going to help families when presented, this is our menu, these are the choices. Many families will choose milk or water, and we hope that'll carry over into influencing better habits, more knowledge, more awareness. California, the first of all 50 states to pass statewide legislation that is at least chipping away at this public health epidemic.
I completely agree. We were one of the co-sponsors of that bill, and so we're really proud that that is now in place in California and that we are a leader in hopefully what will become a national trend. I wanted to carry on something that Senator Monning said about people just not being aware of what diabetes means. I have this thing on my wall in my office that it's a guy and he's standing on a scale and he's saying to his physician, "See, doc, the problem is that obesity runs in my family." And the doctor says, "No, the problem is no one runs in your family." And the joke behind that is we often overestimate the genetic contribution of some of these diseases in our family. For generations, as far back as we know, somebody in our family has had diabetes. And so we think it's inevitable. And so we're not as concerned about it, and we don't often take the steps to prevent because we're not even aware that we can. And so, when we think about diabetes, a very small proportion of it is actually related to genetic factors. Most of them are, as that joke says, things that our families share in common that are not genetics. We often live in the same place. We eat the same food. We breathe the same air. We drink the same water, right? We're doing all of these similar things. We're living similar lives. And we have that in common with our parents and with our grandparents and with our siblings. And so we then begin to think, oh, this must be something genetic. There's nothing I can do about it. I eventually will get the same disease that grandma or grandpa had or mom and dad had. And that's not true. There are many ways that we can prevent this, and some of this is about shifting some of those habits and making us more aware of the contributors to those habits. And that's really what this bill is about. It's about helping people to understand that this is not something that's inevitable. There actually are contributing factors to it, and there are ways that we can shift away from them if we're more aware of that.
You're listening to Then There's California. We're talking about efforts to educate Californians about the hazards to health of sugary soft drinks and other sugary liquids, and the efforts to discourage consumption of those beverages by Californians, either through warning labels or other restrictions. Senator Bill Monning of Carmel, a leading lawmaker advocate reducing childhood obesity and other preventable chronic illnesses through the reduction of the consumption of sugar-sweetened beverages, and Dr. Flo John Kofer, a research and state policy manager with Public Health Advocates. The industry is not here to defend itself as we speak, but I know the industry has come back to you with a lot of responses. The industry is saying they are going all out in every way they can to fight obesity, promote more choices in drinks and in diet alternatives, smaller portion sizes, less sugar. Again, nothing new, I'm telling you, but what do you say?
No, but I appreciate you're trying to frame some of those arguments. So I think both Dr. Kofer and I would agree that we applaud the industry diversifying products to create truly more healthful drinks. The most healthful drink on the planet being safe, clean drinking water, of course. But we have seen some diversification of their product line. The challenge is the advertising budgets that have been used to promote drinks that are not healthful, and how do you trust what they're putting out there and arguing now this is really a healthful drink. So I think, again, the challenge of education, public health education, in the face of the hundreds of millions of dollars of misinformation in their advertising campaigns, that's our challenge. And you see a court saying, well, they have a free speech right, just as tobacco has a free speech right to promote products that we know have an adverse, dangerous, damaging health impact. We need to find a balance. I'm an attorney. I'm the first to argue for the protection and the right of free speech. But we have to have some measurements. We don't let people yell fire in a movie theater. We shouldn't let somebody hide behind the moniker free speech to push products that we know are damaging to people.
I also think it's important to remember everybody plays a role in this. So for industry, their job is to try to make as much money as they can and to sell as many of their products as they can. The role of government is to protect the people. So we are not here asking industries to begin to do another role. We're saying this is the role of government, and this is where we begin to think about what should be the boundaries around how you make your money and how you market and advertise your products and how you label them.
Our Senate Bill 347 does provide a warning label that states specifically, State of California safety warning, drinking beverages with added sugars may contribute to obesity, type 2 diabetes, and tooth decay. And one of the public health issues we haven't gone into in depth today, but I think should be mentioned, is tooth decay, that children, they get a set of baby teeth and they get one set of permanent teeth, as we all do as adults. And the damage done by these sugars that adhere through the product to the teeth, most children aren't going to go brush their teeth right after they've consumed one of these beverages. So there's an added cost to the family. And again, when we're looking at the public health consequences, we can often shift to the public health costs, the cost to taxpayers, the cost to families in dollars and cents. But at the core of this is the quality of life. Children who can have deforming loss of permanent teeth at an early age. That needs to be underscored and stressed. There have been now years of studies, and some recent ones that just came out in the past week, showing causal connection in laboratory animals, at least, of cancers developed from diets heavy in sugar-sweetened beverages and some other adverse health impacts. Those are going to become only more and more popularized in coming weeks.
Absolutely. And thank you so much, Senator Monning, for bringing up the cavity issue, because one of the things I didn't mention earlier is that consuming just one of these drinks a day does double your risk of cavities. And so that's an important thing for us to mention as well, especially because of the impact that can have on our overall health. Despite the fact that we have our own insurance for our teeth, they are a part of our body and they do impact our overall health. And so that's important for us to remember. They're not just cosmetic. One of the things that we haven't mentioned about this bill is that it doesn't actually target every single drink that has sugar in it. It really targets the high-calorie drinks with added sugar. So those that have more than 75 calories per 12 ounce. And that's incredibly important because small amounts of sugar are not the same as having large amounts of sugar. And so we also feel very confident that when it comes to what the FDA is talking about in terms of excess amounts, that when we start getting into the beverages that have really high calorie counts and a lot of added sugar, that's really what they're targeting in terms of that being a part of a diet, as opposed to having, just a small amount of added sugar. And those beverages would not bear the warning label.
Senator, I know this is not your first track at this rodeo. This is not your first time at this vending machine.
Right.
So you have done this even with your own attempt at a soda tax. In fact, that is what even the industry has said in opposition is like, look, we have tried this 3 times in the last 5 years and we've defeated it. Why are you doing this again? I know you're ready for this, but
Yes.
What do you say to the continued response and the continued pushback to bills like SB 347?
Well, we hear that. I've heard it from local media in my district. Why are you doing this again? You didn't succeed last time. The answer is very simple. The problem has not been eradicated. The problem is growing. The public health epidemic is growing in all of our communities, and I'll continue fighting this fight until we see improved health trends in our communities. Cancer, obesity, these are regressive diseases that we find in low-income minority communities because of the convergence of poor health, lack of access to health care, lack of access to preventive care, lack of access to the income necessary to acquire more healthful food products for children and families. It's all connected, but we are out to protect all Californians, and regardless of economic status, ethnic status, but the data will show that it's the at-risk communities that are the ones suffering the most from these adverse health trends, and they stand to gain the most if there's a reduced consumption of these products. And I'll just mention as well, my wife is a family practice physician.
I was going to bring that up. She's a doctor,
right?
Yes.
And so much of what we're trying to do is in the realm of public health education. But doctors, my wife among them, they'll say the hardest thing to do in patient care is to translate recommendations to behavior. And I think we all recognize how tough it is to break certain habits that may occur within families, within communities. They may be generational habits. It's the hardest thing to break. So you can write a prescription on a physician's prescription pad that says you should reduce your intake of sugar-sweetened beverages. And I know some doctors who use their prescription pad actually effectively to hand a mom and children a prescription to start reducing their intake, and it formalizes it in a manner. But the amazing thing, we do, as hard as it is to conform behavior, when you empower parents with good knowledge and information, the best thing we have going for us is they want what's best for their children. And when they're given informed choices, parents more often than not will make the choice that's going to give their child a better future than maybe they had.
One of the news stories about this bill, one of the parents was quoted saying, look, I want my kid to get good grades. And if my kid's getting good grades, he can drink as much soda as he wants. Granted, just one parent out there, but there is that pushback from a lot of the parents, like, this is really the least thing I'm worried about right now in my child's life.
Absolutely. And as we've mentioned, there are going to be parents who are going to fall on the spectrum of my kid never gets to consume any sugar ever in life, even birthdays and holidays. And some parents who are not going to see this as an issue, and that is absolutely their right. And we are not in any way trying to restrict their rights. What we're trying to do is make sure that when parents are making these decisions, that they have all of the information so that they are aware that this is not a benign decision, that it actually can have health consequences. Because for most parents, and I think most of us fall within 1 or 2 standard deviations of the mean. Most parents want their kids to be healthy. Most parents will want to think about what their kids are consuming, even if it's just because they themselves have had health concerns and they don't want that for their children. Like, that's something that most of us share in common, is that we want something better for our children than we had for ourselves. And so providing this information is certainly a part of that. Because I know you had the new Surgeon General on the show recently, I just wanted to, bring up that we mentioned that this is multifactorial. And so, the argument that why are we sort of picking on sugary drinks, this is part of the conversation. And certainly we know the role that adverse childhood experiences play as a risk factor for children growing up to have obesity and diabetes and other diseases like this. That's part of the risk, right? That's part of the many factors. And so it's not as if we're not considering other ways. We have now the Surgeon General whose task is to focus on adverse childhood experiences, and is going to be looking at screening and what we can do in communities. And the legislature has funded work to be able to help cities address adverse childhood experiences. So it's not as if we're only focusing on the sugary drinks. It's just one of the things that we have right now. And our hope is that we'll have more data to be able to talk about the real risk that some of these other products play, so that we can think about how do we make sure that people have information about those as well. But right now, the science is sound on the drinks. And so as science-based organizations, we are really interested in making sure that we follow the science, and that as more comes out, we will continue to move along, but that we don't want to jump ahead of where the science is in terms of its directing our action and protection.
Yeah, and if I could just key off of that, we have many risk factors that may seem more immediate to a parent than a sugar-sweetened beverage, but these are really the silent killers, and you combine it with the targeted, focused advertising, often in non-English languages, directed to communities to get them hooked. They're actually pricing some of these products. The store owner gets a subsidy to cover the distance between them making a profit and getting families literally hooked on these products. It's insidious. I think it verges at times as being criminal in terms of the targeting. Mexico as a nation has put a tax on sugar products and uses the revenue to support public health programs. When President Nieto signed that into law, supported by both federal houses of Congress in Mexico, he said the threat of preventable chronic disease, preventable diabetes, is a bigger threat in our nation than the threat of the violence of the drug cartels. And you think, whoa, that's quite a statement. And he went on to say, while too many are dying from the violence of the gunshots of the drug cartels, more Mexicans will lead a reduced lifespan, a shortened life, because of preventable diabetes type 2. So that got very little media coverage in the United States.
But it makes sense.
It makes total sense.
I think it's important for us to recognize the role that these diseases are playing in our overall health and wellness. And especially because, as Senator Monning has mentioned, in low-income communities and communities of color, there is a stat that really should shake all of us to our core, that 1 in 2 Black and Latino youth born after the year 2000 will develop diabetes in their lifetime. Half of the population. And so if we think about what that means in terms of how many will be diagnosed early, how many will then go on to have, major complications, that's terrifying in terms of what our population's health looks like. A warning label is information that everybody gets. We also have an icon that is on the warning label so that even if you are low literacy, even if you have limited English proficiency, you can identify that icon and use it to be able to identify which products have added sugar and have more than 75 calories per 12 ounce. So we think this is a good strategy to be able to give people information across the board and help people to just raise their awareness that all of these products are not created equal. And one of the things that's always stood out to me as an epidemiologist is, really understanding that how many people struggle to follow basic health information. The things that we think are really easy, like people will say, well, there's a nutrition label on the back. Well, many people don't know exactly how much potassium they're supposed to have in a day or how much added sugar is too much added sugar. And, many of our products that we're consuming, especially if we're consuming at home, may be more than one serving. So we're not even aware of exactly how much we are consuming on a day-to-day basis. Many people struggle with being able to follow basic instructions on a prescription label about how many times a day to take the medication and what it means to take it with food and things like that. So we sometimes take for granted that people have all of the information already at their disposal to be able to make decisions, when very few people in our country actually would be able to follow instructions if they were given in this way. So part of this is democratizing, if you will, the information that we have and making it accessible to everyone. So it's very clear what this means, as compared to hoping that people will get a nutrition degree in order to be able to figure out what to eat every day.
Part of the blessing here is that I see, and Senator, I even read this in the analysis of your SB 347, that voters here in America, 74% of them are already in favor of requiring labels. So this isn't a huge convincing learning curve you're dealing with.
That's right. In fact, I think we face a tougher challenge sometimes here in the legislature winning votes than we do have winning public opinion support for what's a very common sense consumer right to know effort. You alluded to it earlier. It's no secret that Big Soda spends big money in this Capitol. They exercise their influence and their lobbying power in an extraordinarily powerful fashion. And our weapons are the weapons of community engagement, grassroots engagement, talking to electeds around the state in their home districts, and relying on science, relying on data and facts, and ultimately to personalize it always to the health of children, the risk of shortened lifespans, and a loss of quality of life.
I am grateful to both of you for being on here to talk about these facts, to drill down on the quality of life issues that this issue involves. Dr. Cofer, you're fabulous. Thank you for the facts and the science and the information. Hope to have you back in some capacity on our podcast in the future.
I would love that.
Senator Monning, always good to talk to you and discuss these issues.
Thank you, Brian.
I know you're blessed by having between your own doctor wife and Dr.
Right.
Cofer, you've got a lot of database here.
I'm getting a lot of advice about my own lifestyle choices.
We'll save that for another podcast.
My
okay?
husband's a nutritionist, so I think you and I are both in the same boat.
Yes.
Yeah. Thank you both so much for being on Then There's California. Senator, good luck with SB 347 in this legislative session. And that wraps up this edition of Then There's California. It's a production of the California State Senate Democratic Caucus with technical assistance and great ideas and support, as always, from Martin Ashley, Bob Brulte, Brian Shadden, Rainier Sabiniano, George Soares, McLeana Woods, Ariana Medell, Lisa Murphy, Aaron Kashishian, and the graphic design talents of Tim Davis. On behalf of Senator Monning of the 17th Senate District in Monterey and San Luis Obispo counties, and Dr. Flojan Cofer, a research and state policy manager with Public Health Advocates, I'm Brian Green at the State Capitol in Sacramento. Thanks for listening to Then There's California.